Welcome to the Mad in America podcast, your source for science, psychiatry, and social justice. Our podcasts are made possible in part by a grant from the Thomas Job Fund. Hello, this is James, and welcome to the podcast. And this week we are discussing something that is close to my heart, and that's the impact of mental health-related podcasts on their listeners. I'm joined today by Dr. Sharon Lambert and Naoise Caoilte from University College Cork in Ireland, who have studied the motivations and experiences of mental health-related podcast listeners. Their recent paper is entitled Podcasts as a Tool for Enhancing Mental Health Literacy, an investigation of mental health-related podcasts, and it appears in the journal Mental Health and Prevention. In this interview, we discuss the importance of mental health literacy and ask if the need for honest mental health experience is being met from the recording studio rather than the consulting room. Sharon and Naoise, thank you both so much for joining me today for the Mad in America podcast. And so excited to have you both to talk about a really interesting recent paper of yours entitled Podcasts as a Tool for Enhancing Mental Health Literacy. But if it's okay, before we get to talk about the paper, I just wondered if it's okay if I could ask you both to kind of introduce yourselves and maybe say a little bit about what you do at University College Cork.
Yes, so my name is Sharon Lambert and I'm a psychologist and an academic researcher. So I am researching and teaching in applied psychology at UCC, and my areas of interest are the relationship between psychological trauma, traumatic experiences in a very broad sense. So that includes things like poverty and social exclusion, and how that impacts on thinking and learning and behavior. But I'm particularly interested in how people design and deliver services so that everybody can use them. So socially excluded groups. And I suppose that came from I worked in the community with socially excluded groups. So that's where my research interests lie.
Great, thank you.
My name's Naoise Caoilte. I'm a recent graduate of the Masters at University College Cork in Applied Psychology and Mental Health. And it was there that we started this piece of research. Sharon and I became interested in exploring some of the podcast listeners' experiences. And at the moment, I work for the health service executive here in Ireland as part of a primary care psychology team.
Great, thank you so much. Was there anything particular that made you interested in what podcast listening might be doing for people's knowledge and beliefs about mental disorders?
I suppose it came about as a conversation. So I have appeared on podcasts before that would be mental health related podcasts, and my experience of being a guest on those podcasts was that people would contact you afterwards and say, I heard you speaking on such and such a podcast, and I've been struggling a lot, and it was the first time that I'd ever connected maybe my social context like poverty or difficult experience that I'd had. And I'd always thought that maybe there was just something fundamentally not good enough about me. So I thought, there was a bit of a sadness around that the most socially excluded people are the ones who don't have access to that information. And then I saw a newspaper article that was criticizing podcasts. And it said, well, is this a good thing? You have all of these people online talking about mental health and people who have mental health issues listening. And is that a good idea? And I thought, well, my experience of it is that it has been, positive, but I don't know because we don't have the research. And Naoise and I were chatting, and he listens to a lot of podcasts. So we came up with the idea and went with it.
Yeah, I think that for me as a student at the time as well, studying psychology, and I was also on placement working with families in the foster care system here. And what I took away from listening to podcasts during that time was hearing people's lived experiences, people who may have experienced coming through the care system, or people sharing their mental health stories. And that gave me an insight into, the therapeutic process and the sort of the psychological world that you don't necessarily get from books, for example. So that was, from that sort of professional development point of view, I found podcasts to be really beneficial for me.
That's great. Thank you both. And so could we maybe talk a little bit about the approach you took for your paper, and if you could share some of the results, that would be really good.
Yeah, so I suppose as Naoise said, we had a great conversation about podcasts and what I was hearing about what people were getting for podcasts. And then Naoise brought this extra perspective. Well, actually, it's not just, people who are struggling who are gaining from it. It's also, students potentially getting professional development from it. So kind of thinking about all of the different various groups that are listening to podcasts and what they might be getting. So Naoise had a look at the literature and he found that there was almost nothing there, really. So we created a survey and Naoise worked really hard in getting that survey out. And over 722, there was more than 722 responses, but by the time, taking into account the ones that could be used, there was 722. What was interesting about the survey was every time I do a survey for research, I always put in this box at the end that says any other comments. And no one ever fills it out. Or if they do, they might say, that was a stupid effing survey or something like that. They don't, it's never really that meaningful, to be honest. But I still persist and put in that little comment box, hoping that somebody will fill it in. And we were really blown away, actually, by the comments and the amount of them and the level of engagement with that particular section. And the quality of the information that people gave about their experiences. And I can talk about that in a minute. If Naoise, perhaps you might want to come in and talk about, the survey findings and the statistical analysis that you did there.
Yeah, so we asked participants about their demographic profile, so education, annual household income, etc., as well as their motivations for listening to mental health podcasts. Their own personal experience with mental health, whether they'd accessed mental health services before, and then finally what their experiences of listening to mental health podcasts were. The results are quite interesting when you look at why people listen to podcasts, and we found that above all, it was out of a desire to learn about oneself and to learn about mental health more generally. And when you do a piece of research like this, you're always interested in what are the differences in people's responses, maybe based on their demographic profile. And one of the patterns that we began to identify was that for participants in lower educational brackets, i.e. those who also tend to have poorer mental health literacy and knowledge of mental health, reported using podcasts to learn about themselves and mental health much more than their more educated counterparts. And those in higher education brackets actually reported using podcasts for entertainment much more, which was quite interesting. And it's quite a promising result, I think, because it maybe shows that those who need it most are taking the most away from listening to podcasts. And that was a trend that sort of followed throughout the whole paper, even down to when we asked people about their experiences, those in the lower educational bracket, as well as, I believe, those with lower annual household income, reported that their experiences were more based around learning new information and skills. When we asked them about their experiences, like I mentioned there, it was the most rated statement was that they learn new information and skills. And after that, it was that podcasts help normalize problems and foster connections. What I see in that is that normalization of problems is really a destigmatization, and creating connections is maybe creating a validation and a sense of community amongst listeners. And there's so much rich data within that qualitative piece that sort of really brings the statistics to life as well.
Yeah, because actually, as Naoise was speaking there when he said, that the highest rated item in the survey was for new information. Because one of the criticisms that had been made about podcasts was, is there a danger that people who have mental health related difficulties are sitting at home listening to podcasts and that they're they're doing some kind of therapy on themselves and not seeking professional support? And is it dangerous? Are podcasts dangerous? That was one of the things. So one of the items that was asked was, do you use it to process difficult emotions? And it was not an issue, So that kind of ruled out that concern. And as Naoise said, the statistics that he's outlined there are super interesting, because what it did show is that the people who are from areas are from lives of lower socioeconomic status, who do find it difficult to access services and who are often shut out from education as well, that they are gaining a huge amount in terms of mental health literacy. They were starting to realize that these struggles that they were having, that lots of other people have them too, and that it did make them feel more connected. And especially, I suppose, it came up in the data around COVID. Lots of people were very isolated, and that they felt quite connected to particular podcasters or some of their guests. Because what people liked actually was a mix of guests. They liked a mix of hearing a professional by education speak about a particular difficulty or challenge. So we'll say, psychological trauma, and what does that mean? And then that somebody then with lived experience might be on the following week saying, I experienced a traumatic event. This is the impact it had on my life. And these are the different kinds of barriers that I had in terms of access and support. And then this is how I did get on my recovery journey. So that kind of, real raw sense actually of the reality. Because sometimes actually when we present lived experience in professional environments, is that we bring on people who are really successful in their recovery. And it's often presented as this is amazing and this is how easy it is and everything is great now. And what you don't often hear in those contexts actually is the fact that it isn't a linear journey, that there have been lots of setbacks and that there are lots of barriers. And one of the things with the independent podcasts is that people are, I guess, not restricted in terms of being really honest about what worked and what didn't work, So that data, when we looked at that, it kind of came up with 5 overall themes, and they were around accessibility. And accessibility means a couple of different things, and I'll come to that in a minute. Mental health literacy, some potential pitfalls, reassurance, and lived experiences. So in terms of the accessibility, it really meant 2 different things. There was the practical element. So it's free. I can access it at any time that I want. And there aren't geographical barriers or financial barriers or transport barriers. But the second point around accessibility was actually the language that was used. So people are speaking to me in a way that I understand. And if I don't understand it, I can listen to that episode 2 or 3 times until I do understand it.
That's so important, isn't it? And I think it is a kind of theoretical part of the paper, but I think the paper says that if people attend a service, or they might have a kind of a crisis response, and the medical professional might be just responding to their symptoms, but there's no time to talk about social factors and all the other things that might have led them there. But podcasts allow the time for people to absorb that information in their own comfort, in their own space, and in their own time.
Big feature of that accessibility was the language being used. So because you often had lay people and people with lived experience, they'd say, well, I have experienced this, and what that means is that. So there wasn't that assumed knowledge that perhaps sometimes happens in other consultations. And when people do go to appointments, they can be embarrassed to say, I don't understand what you're saying. Actually, I have never heard of what that word is. So they can just sometimes nod and agree and then leave and feel, particularly people in addiction feel a lot of shame, actually, a lot of shame and a lot of stigma. So if you're there and somebody says something and you don't know this, it's another thing to feel ashamed about. So being able to access that information was really important. So one of them was potential pitfalls. Now, if you were being really academically rigorous, you wouldn't have included this theme at all. There was 5 criticisms. Yeah, 5 out of 722, where somebody said a potential negative. Naoise had said, look, it has been said it's important to these people. There are people who say, well, there could be potential pitfalls. So, let's report the potential pitfalls. So one person said that they had obsessive compulsive disorder, and that what had happened for them was that podcasts had become part of a compulsion, that they had to listen to them a lot. And that person was a professional. They said that they were concerned about non-professionals being involved in podcasting. But of course, that's their bias there in terms of their professional training. But can you remember what the other ones are, Naoise?
It was 1 or 2 around what you mentioned there about podcast hosts and guests not having professional expertise, and then potentially the issues with podcasts not being regulated, and the concerns of, I guess, individuals who were worried about misinformation, particularly in the context of mental health, where it's important not to spread misinformation, essentially. So they were valid concerns, and while they were few, they were worth looking at and worth reporting, because even though in our sample there was only 5 or 6 people, I'm sure that out there are more who are concerned.
I think it was 3 people said that they were concerned about professionals not doing this stuff, and that it might be a non-professional, whatever that is. One of the quotes was, I do think with the lack of access to professional services and increased availability of podcasts, there's a risk that people can take a podcast host's advice as seriously as they would take a healthcare professional's advice. So I suppose the problem there is assuming that the healthcare professional's advice is always right all of the time, and sometimes it's not. But actually, the data did not indicate that that's what was happening. What it did indicate, actually, was that listening to podcasts wasn't making people not look for help in various different places and spaces. It actually was increasing help-seeking behavior. And we have a quote in here, I'm less hard on myself. Podcasts have encouraged me to open up and speak about my issues.
In the paper, it says that researchers indicated that mental health literacy is positively associated with help-seeking behaviours and negatively associated with stigma, shame, and negative attitudes towards mental health. And that's so incredibly important, isn't it? Because podcasts, I guess, give a kind of non-medical space for people to discuss really uncomfortable and difficult thoughts and feelings without necessarily feeling that things have to be labelled from a medical standpoint, but they can talk in purely human terms, can't they? So I can see how mental health literacy might seem like it's a medicalized thing, but it isn't actually. It's actually reducing stigma and making people more likely to seek help if they need it.
Yeah, there's a lovely quote here from one of the participants, and it says, while I've suffered from depression for 10 years now, I sometimes still struggle to describe it to family and friends. Listening to peers share their journeys has helped me give both the language and the confidence to speak more about my lived experience. I mean, we could be here for hours, James, reading out some of the quotes, because they were just so powerful.
And what you mentioned there, Sharon, about the lived experiences, I think that, and this kind of ties into people questioning, the expertise of podcast guests. And I think the addiction services have known this for a long time, which is that even though they might not have professional qualifications, people with lived experiences or peer support workers can be just as valuable to the therapeutic and the recovery process as professionals. And in addiction recovery programs, peer support is a huge part of it. What we found was that our participants who were listening to lived experiences were getting a sense sometimes of hope, and sometimes of connection, and sometimes of community when they hear somebody. And it's a really important aspect of that as well, is that they hear somebody who looks like them, or who sounds like them, or maybe is from the same socioeconomic background as them. And when they hear that person share a story that resonates with them, that has a therapeutic power in and of itself.
Yeah, absolutely. That's so important. And you mentioned earlier, that there are virtually no barriers to accessing these others, so they're easy for people to get hold of and easy to consume in a time that kind of matters for them, and they can listen multiple times. Or if they're struggling in the middle of the night, there's somebody comforting there that they can listen to. The point about misinformation I find really interesting because, of course, as we know in Mad in America, there are examples out there of professionally produced podcasts where there is still misinformation going on. Maybe they're talking about chemical imbalances, or maybe they're talking about areas of mental health as if it's settled science when it isn't really. And equally on the other side, we are aware that there are paid influencers out there that might be covertly kind of funded by the pharmaceuticals or whatever. So I guess misinformation is a concern, but part of me also thinks that talking about the full range of experiences and possibly considering what might or might not be misinformation, and the freedom of a podcast as a platform to do that is probably quite a healthy thing too, isn't it?
Yeah, because if we think about human beings as biopsychosocial beings, as we exist within social contexts, I do believe that it's shifting and changing in psychology, not as fast as probably some people would like, but there is more of an increasing understanding of social context, and, for example, how poverty as a driver for mental distress, and how should that be responded to. So that's not a psychological disorder. It is somebody who is deeply distressed because they are living in a really difficult situation, and maybe at risk of homelessness or in homelessness. So their distress is appropriate for the situation that they're in. So that conversation is happening. It's shifting, it's changing. I know folks in Mad in America have been talking about it for a very long time, and you would prefer if those conversations were happening faster. But to kind of bring it back to the podcast is that people are interfacing with various different disciplines or models of understanding of mental health. And I know that you will say in Mad in America, that there are particular diagnoses that are not helpful. And I would agree with you on lots of that. And then sometimes I worry that about, because there are people who receive a diagnosis, and for them, it's a relief. And then I think for me as a psychologist, I have to be really careful that you don't come along and say, well, that thing that you have, there's this big group of people who don't believe that exists, so, and that can be quite devastating. So how you can manage that in a way that is helpful is by conversations around different perspectives. So, some people would have a very biological understanding of mental health. Some people would have a very psychological understanding of mental health. I would probably fall down more on the social understanding of mental health, but I need to understand all of them, actually. And I think for people who might be having a difficulty, once they start to improve their own mental health literacy by access to this information, then what they do is they start to, if they've had limited access to education as well, they start to say, I'm learning a lot and I actually want to learn more. So then they will start to listen to different perspectives, and they will learn about things that you might not have learned about before, like the social determinants of health, and how poverty is one of the biggest predictors of addiction and poor mental health. So I think that podcasts do create that space. I do think that what they are doing, all of the different ones, is saying, here are a host of multiple different perspectives. And then sometimes we underestimate people's ability to be able to sit back and go, that's really interesting. I hadn't thought about it like that. Where does that fit with me? And for me, that's what matters. Is what do you need in order to go on your journey, your recovery journey? What works for you?
Yeah, absolutely. They can find experiences that resonate with their own experience, can't they? Which is so important, to feel not isolated and to feel connected, and for people to feel, oh well, there are people out there who have had broadly similar experiences, and it was interesting to learn how they thought about it or dealt with it or haven't dealt with it or whatever else. So, that kind of menu approach of having a range of views to choose from is so important, I feel.
On that piece about feeling isolated, like you mentioned, James, I did a quick control F on the qualitative data earlier today, and the words "not alone" together come up over 120 times. And that was one of the major takeaways under the sort of qualitative theme of reassurance and validation, was this sense of feeling not alone, not isolated in your mental health issues or whatever struggle. And people kept saying things like, I've realized that everybody struggles, or I've developed a sort of compassion for myself and others because I've been able to understand, my struggles in the context of my past experiences or something like that.
I couldn't help but identify myself with so much written in the paper, firstly as someone who runs a podcast, but secondly someone who have had mental health struggles myself, and I got into podcasting it precisely because I felt alone and disconnected and couldn't easily leave the house. I really do value, I think, the space that podcasts can fill that professionals couldn't do even if they wanted to. They wouldn't have the time available or the resource available to do that. So it's a brilliant and fascinating piece of work that you've both done together and with your co-authors. And I wondered if you'd had any thoughts about, are there further developments to this work? Is there more that could be done with looking at the role of podcasts in helping people perhaps come to terms with their thoughts, knowledge, and beliefs about mental disorders?
Currently, I have a master's student who is looking at the role of podcasts in probation clients. So these are people who are in difficulty with the criminal justice system. So where that came from actually was because of an Irish-based podcast called The Two Norries. And the hosts of The Two Norries are both in recovery from addiction, but have had significant experience with the criminal justice system, including periods of imprisonment. And like you, James, during their podcast emerged actually during the first lockdown, because the support structures that were available to them to maintain their recovery were gone. So they were worried about themselves and they were worried about their community because they're from an area of socioeconomic deprivation. And they had this idea to set up a podcast, which they did in Timmy's shed, in his back garden. So, but what happened then was there were no visits allowed into the prisons. So the prison service in Ireland started playing the Two Norries podcast into the cells.
Wow.
And then the psychology service in the Irish prison service started to notice that, people were developing a language that they probably wouldn't have gotten if you gave them something to read, a more formal produced document from a health service, for example. And they were saying, this is really interesting because people who are in custody now are coming, looking for the psychology service, and they're saying, using words like, I experienced this difficulty and it was a trauma and it might be linked to my addiction and other social problems that I'm having. So Dr. Emma Regan from the Irish Prison Service liaised a lot and continues to liaise with the Two Norries around the impact that's having in the prison service. So then that led me to thinking about, people when they've left custody and they're now, linking with a probation officer. So my current master's student, Sally Condon, has interviewed probation officers about, do they think podcasts are a useful tool for probation officers? So she's just finished her analysis and she's writing up her dissertation. So it's not published yet. It has to go through the whole university process. But what was really interesting was it is really similar to Naoise's findings. And she deliberately didn't read Naoise's papers in case it would impact, how she might think about themes. So when she came to me and she said, these are the themes that have come from the data, I was like, that's so interesting because they're the themes very similar to the themes that came from Naoise's paper. So I suppose primarily what they noticed, probation officers, were that people who were struggling with mental health and addiction difficulties, and that was leading them to involvement with the criminal justice system, that they were turning up to meetings and they were having entirely different conversations now. So the chaos that they were experiencing in their personal lives was starting to make sense. And once they had access to information, then it became this thing that was in their awareness and that they could do something with.
Something that we saw reflected in the results was clinicians and healthcare professionals who were reporting using podcasts in whatever healthcare setting they were in, or using them as resources for clients. And that's something that's reflected in the literature as well, not to a large extent, but we discussed that and feel that there would be a lot of value in speaking to professionals as well as speaking to people like yourself, podcast creators, to get their perspective and experience on that. And I think that would give another side to this research as well, which I think would be really meaningful. The other thing that we felt would be very valuable is in some way getting a quantitative measure of the impact of listening to mental health podcasts, maybe measuring mental health literacy using a scale. That would be like a sort of experimental design, I guess, something, maybe down the road.
Fantastic. Thank you. And kind of, before we come to the end of this, Sharon, you mentioned the comment box you put at the end of the survey. It's very important for us to do that on podcasts too. So, was there anything else related to the paper that you think it's important that we should share with the listeners?
I suppose the most important thing that we heard was, for the vast majority, exceptionally high number of people, that podcasts are a positive thing. That they are positive in terms of being available. The language that's being used is understandable. The varying experiences and perspectives that people are exposed to. So that it's not just one particular perspective or one model or one life experience, that it's a whole vast range of all of the different things that can go on in this space. And then that is contributing to the development of mental health literacy. And knowledge is power, and people can make decisions for themselves when they have access to knowledge. And people are feeling less alone. They're feeling more connected. Their experiences are more normalized. It is decreasing stigma. It is increasing help-seeking behavior. And they are just an incredible resource for people. The 99.9% of the experiences are just incredibly positive. And I see a quote that's just popped up in front of me there. It demystifies mental health, emotional issues. I learned so much about myself and others. I find it's helpful at building empathy when you hear about other people's struggles and stories. So not only did people increase their own compassion towards themselves, they increased their empathy for others. And that's important too, that when we increase our self-compassion for ourselves, that we also have empathy for others, because that's what will make you a happy, healthy human being, is being able to love yourself and to love others.
Well, thank you both. I'm so pleased to be able to talk to you both about this, because to have podcasts for mental health validated in this way it is really important. And, the sense of connection they bring, the demystification that goes on, the kind of discussion around the margins of what you might hear in a therapy appointment or a appointment with a professional, the fact that you can broaden your understanding by listening to a range of experiences is so important. And it's genuinely a fascinating piece of work, and thank you both so much for doing it and for being willing to join me to talk about it.
Thank you, James.
Thanks so much for having us on.
Well, I just want to thank Sharon and Naoise so much for being with us to talk about their work. You can find a link to their paper in the write-up of this interview on madinamerica.com. And if you are a regular listener to podcasts discussing mental health that you find helpful, do share them with others on social media, as it really helps to broaden an important conversation. Okay, so as always, thank you so much for listening, and until next time, take care. Thank you for listening to the Mad in America podcast. For more news, views, and updates, visit madinamerica.com.